Brows uneven after Botox. How to fix a lower eyebrow. The lower eye and brow is a prosthetic eye, but this has never happened this extreme before. What can I do?
Thank you for your question. You're concerned about your brows being uneven after Botox, and you state that the lower brow is the side which has a prosthetic eye, and and you've submitted photos with your face at rest, and then with elevation of your brow, and it becomes more clear on one photo that the right brow goes up and the left brow does not, and you want to know how to fix the left brow. Well, I can certainly share with you my approach to helping patients with Botox. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and I've been treating patients with Botox since 1993. Our specialty was amongst the first group of doctors to use Botox, and really the world has expanded so much with the many uses of Botox. So to basically go over the physiology and basis of what you're experiencing, essentially to deal with what is generally forehead wrinkles, there is a muscle called the frontalis muscle, and this muscle has a vertical orientation. When this muscle is engaged, the eyebrows go up. Very often when people have a certain habit, or with aging, as well as some situations where their eyelids are drooping, they use that muscle a lot. And so strategic placement of Botox can help reduce the lines. Some people prefer no muscle activity on the forehead, so they have a very smooth forehead. Now, one of the consequences of that is that the brows can droop. Now, judging by the photo, it appears that you have some residual activity on the right side and no activity on the left side, which is the explanation as to why the left brow doesn't come up at all. The unfortunate reality is that you cannot reverse Botox. This requires essentially time to let the Botox wear off on that side so that the brow comes back up. Now, every doctor who does Botox, I'm sure, can relate to this type of situation, because dosing is something that can have variable impact even when you know the patient for a long time. But I would say that it is advisable to bring this to your doctor's attention, so if this is the doctor you're going to regularly, the doctor will know to adjust the dosing and placement for next time. In our practice, when we do Botox, whether it's for wrinkles around the eyes, for frown lines, forehead, for lip lift or chin dimples, I mean, there are many uses of Botox, we have patients come back after about 2 weeks to assess the effect and to see if we need to enhance or at least document what is the optimal dosage and placement for that patient. And that's an important thing, that hopefully you have that with your situation. I think if your concern is mostly about symmetry, well, then one could consider additional Botox over the right brow so that the right brow comes a little bit lower. Now, that may not be desirable because you may feel like the brows are too low. And if your eyebrows are much too low, then you're not going to like that either. So I think it's very important for you to discuss this with the doctor, review the dosage, review the amount, and just allow some time to pass, and then the Botox will wear off, and then you can allow for the next time for maybe more conservative treatment on that left side. I always tell my patients, it's better that you come back in 2 weeks so I can add, because I can't with Botox subtract. So I hope that was helpful. I wish you the best of luck. Thank you for your question.